In the United States, an estimated 26 million men and 23 million women are smokers. And statistics show that someone dies from tobacco use every 8 seconds. Obviously, this is a deadly habit that is considered an addiction. We spoke with Dr. Jonathan Reitman of Clean Treatment Center in West Hollywood, California, to find out how this center helps its patients kick the habit.
The health risks associated with smoking are incredibly widespread. Some of the most common ones are lung disease, particularly the development of emphysema or chronic bronchitis, also being a risk factor for lung cancer. But there are many, many other organ systems that are affected by cigarette smoking too. The upper digestive tract, such as the tongue or the throat, may be affected. There are much higher rates of cancer in those areas in smokers. Smoking seems to be a risk factor for the development of kidney cancer. Smoking is associated with cardiovascular disease and predisposes to strokes and heart attacks. So there are many widespread effects of smoking, all deleterious. So far as we understand, there's probably not a single health benefit to smoking.
Dr. Reitman explained why cigarettes are so addictive.
Nicotine is the addictive component of cigarette smoke. Research varies, but we believe that it's a tie between cocaine and nicotine as far as what is the most addictive substance for humans. So nicotine is a very, very highly addictive substance. Physical dependence on nicotine is extremely hard to break.
We asked Dr. Reitman what treatments are available to quit smoking.
We have several medications that do increase the odds of successfully quitting smoking. Some of them are as simple as replacing the nicotine that one gets through cigarettes through another delivery system, like using a patch or using nicotine gum. We do have 2 FDA-approved prescription medications that can help curb desires to smoke. Used alone or in combination with nicotine replacement products, those can dramatically increase the odds of success.
And what if you don't inhale the smoke? Is it as harmful?
I think that is the perception of a lot of people, that if you don't inhale the smoke, it's not as risky. Problem is that other types of smokeless tobacco or pipes still raise the risk of oral cancer and are associated with other adverse health consequences. So it's not good enough to switch from a cigarette to a pipe.
We asked Dr. Reitman if what are called electronic cigarettes help.
You know, the electronic cigarette seems to be effective for some people in replacing the cigarette. It does provide some curbing of the desire to have the physical sensation of smoking the cigarette. There are some slight concerns that there may be some health risks associated with that too. So we're not prepared yet to unequivocally recommend those. There may be a role for developments in that area with further research and progress.
If someone's not able to afford help, where can they get assistance?
A mere doctor's advice to quit smoking increases the rate of smoking cessation and improves the odds. So a visit to a doctor can be very helpful. Fortunately, we have other good resources available. Because there are high taxes imposed on cigarettes now, we do have a public system in place to help people quit smoking. I would start with nothing more complicated than calling 1-800-NO-BUTTS, N-O-B-U-T-T-S. They will offer counseling and other forms of support that are freely accessible to all who avail themselves of that service.